At HIMSS National, we're very enthusiastic about helping to support your local chapter event here. Certainly, this is one of the most active local HIMSS chapters in terms of healthcare privacy and security issues. And so, as part of my presentation today, I would like to give an overview of what we are doing at HIMSS National, both in terms of education and advocacy. I understand that there may be some non-HIMSS members here or folks with other organizations as well. For everyone that doesn't know, the Healthcare Information Management Systems Society is a nonprofit organization. It is headquartered in Chicago. We have over 50,000 members in the U.S. and elsewhere. And we have, I am personally based out of the Arlington office, and so, to that end, I have to say that HIMSS has something for everyone in terms of education and advocacy, as Jim had mentioned, and to that end, in terms of my presentation, I'm going to give an overview of the kinds of efforts that we're doing, because one of your chapters, Not SoCal, had asked me, what are you guys doing at HIMSS National, if anything, on privacy and security? The answer is we're doing a lot. So, first of all, what is HIMSS National doing in terms of privacy and security initiatives as it relates to advocacy? Earlier this year, as we do every year, we set forth public policy principles. All these slides are hyperlinked, so should you have a local copy, you can certainly access that, and it'll pop open the page for a public policy principle should you want to follow along. There is a section on privacy and security within this document. It is a foundational document by which we at HIMSS National submit our advocacy comments. And so anything that we submit to the government, and that is federal government, to the various agencies, is based upon one or more of these principles. And if it's not, then we have to get official board review from our HIMSS National Board and approval from our executive VP. Some additional advocacy activities that we did, and again, all these advocacy activities are in concert with our government relations team. We suggested improvements to the HHS Security Risk Assessment Tool, the SRAT. Earlier in the year, we provided comments to the NIST Cybersecurity Framework, which ultimately became version 1.0. We hear that NIST is very interested in revising the cybersecurity framework based upon input from the public and private sector and otherwise. We have been very active throughout that process. We also submitted comments to the CMS. They had a proposed rule on emergency preparedness requirements for Medicare and Medicaid participating providers and suppliers. The word cyber only appeared twice throughout the lengthy proposed rule, but we had essentially stated to them, look, if something happens to your IT systems, that is potentially a disastrous event. And so in terms of emergency preparedness, you may want to think about regulations or guidelines for providers in case there is an emergency. We are also very active in terms of the Certified EHR program. Lisa Gallagher is my VP of Technology Solutions, and as a result of her participation on the faculty committees, we are active in terms of certified EHR technology comments. And the criterion used to certify EHR technology, what's commonly known as the Chapel list, all that software is certified as to federal standards. We did submit a response to the FDASIA Health IT report regarding when is a medical device actually regulated under FDA under the Federal Food, Drug, and Cosmetic Act. We submitted a response to Senators Grassley and Wyden on data availability, essentially mentioning don't forget about information security. It's one thing to have technology, but it's another thing to not tether it and not harness it so that the flow of data is safe and secure in addition to the technology working and delivering the results. We also submitted a response to ONC's draft interoperability vision. As of today, our government relations team had sent around word that ONC has published the interoperability roadmap, and so we are gathering comments. That notice will be pushed out to HIMSS members, I think, in the intervening days. Educational initiatives at HIMSS National. These include those current and future with agencies such as FBI and DHS ICS CERT. And for those of you that don't know, Industrial Control Systems CERT is very active in terms of looking into and addressing and mitigating medical device security vulnerability exploits. Sorry, we also partner with a number of associations to produce and disseminate educational deliverables, such as the American Medical Association. Any of you that are physicians are in the room, or if you know of a doc that needs to keep up their license, you get 1 free CME credit by listening to the podcast. We also celebrated for the first time this year National Cybersecurity Awareness Month, I should say last year, and Data Privacy Day on January 28th. And so if you click on those links, we'll have resources in terms of podcasts and tip sheets. Recently, and this was read into the record of a January 27th hearing, recently we at HIMSS and 34 other associations submitted a coalition letter to the U.S. Senate and essentially saying, look, in terms of, unfortunately, the very aggressive cyber threats that our country has been affected by, we really urge the Senate to quickly pass threat info sharing legislation. Those of you that have closely tracked this know that the CISPA bills and the other variants of those information sharing bills trying to spend years trying to pass that legislation, but always it's a huge political issue, as you know. And so, we hope to push through that, help Congress push through that legislation, but then I should say that it won't be done blindly. There's a lot in terms of considerations such as how big should federal government get? Should they preempt state law? Should they limit liability in terms of sharing threat indicator information? And on January 28th, there was that Senate committee hearing on Homeland Security and Governmental Affairs. Just to give you a high-level overview, and you can look this up on the internet, it was webcast, it was a great hearing. This just goes to show you how much policymakers have on their minds the cyber threat, and that they are very interested and active on the Hill in terms of addressing the cyber threat as well. So yes, the government is listening. The highlights from the hearing include there's a need for information sharing, just like in our CISA bill, in our CISA letter that we had sent. The folks testifying did speak about the need for liability protection for those that do share the cyber threat information. There was talk that cyber attacks can pose significant threats to critical infrastructure. I don't think I need to explain that to anyone in the room. We all know how vulnerable the industrial control systems are. We know how much the cyber physical interface is no longer something of fiction. It actually does happen, and should anyone penetrate into those systems, that could cause problems. One of the worst fears, I think, in terms of this country is someone shutting down our power grid, and we're totally dependent upon power. Also stated during the hearing were the nation-state actors, and what we're concerned about as a nation. Federal law enforcement, as according to the testimony, the public testimony, they said that federal law enforcement typically notifies a victim about a breach. About 30% of the time does the victim ID it on their own, and that, at least according to the testimony, intruders spend about 74 days within a network before someone notices. That's not good at all. Advanced persistent threat indeed. Okay, and I've certainly been asked this question as well. What are we doing in terms of cross-sector information sharing with others outside of healthcare? Well, those of you may or may not know that we informally participate in cross-sector information sharing. There's an informal coalition. Those of us in DC, there are various associations like the associations in water, electrical, the comms sector, energy, finance, internet communication technologies, manufacturing, and the transportation sectors. We all monitor two things. One is the NIST cybersecurity framework, and we also monitor, okay, what are you associations doing to educate folks in terms of cyber risk management? And then we feed as appropriate surveys and other initiatives to our membership. Just a little bit in terms of recently passed cyber laws that may affect us, we'll see. Most of you probably know, maybe some of you or a lot of you already engaged with the NCIC. Senate Bill 2519 was passed on December 18th, I should say signed into law, National Cybersecurity Protection Act of 2014. And the bill does not change anything of what the NCIC does. The NCIC does exactly what the bill codifies. The NCIC analyzes cybersecurity risks and incidents. And some of you may not know, but many of you may, that the NCIC U.S. CERT also provides services to the private sector when mitigation is requested should there be a problem on your network. And also through the C-Cubed voluntary program, U.S. CERT will provide recommendations in terms of security and resilience measures to enhance cybersecurity. And the model of that is based upon their guided implementation, so they're guiding of you in terms of how to implement the NIST cybersecurity framework as a voluntary way to reduce your cyber risk. The Cybersecurity Enhancement Act of 2014, I'm interested in seeing what comes from this. Basically, under this bill, which was also signed into law on December 18th, it authorizes NIST to produce even more voluntary industry-led standards to reduce cyber risk. So you saw the NIST cybersecurity framework. There may be even more guidance documents coming down the pipe. And this bill also calls for more public-private partnerships. So us working with government working with us working with other folks in private sector. Governmental initiatives at HIMSS. What are we tracking? Those of you that may have listened to the January 27th Senate hearing, which I alluded to earlier in these slides, there is an interagency cybersecurity forum, and it includes federal agencies including FTC, FCC, DHS, FDA, and the advisor is NIST. So the concern there, at least with some of the associations, and I'm not speaking for HIMSS, is that the concern is that even though NIST has said, look folks, the cybersecurity framework is totally voluntary. NIST is not a regulatory agency, as those of you may know, but these other agencies are either enforcers or regulators that are part of this cybersecurity forum. So through that information sharing coalition that we spoke of, essentially we are tracking what they are doing, and here at HIMSS, let's say that we aren't opposed to new regulation, but we always carefully measure it and the impact on our members. The Computer Fraud and Abuse Act. It has long been used as a tool to prosecute folks that hack into systems. In layman's terms, the Computer Fraud and Abuse Act is a federal criminal law which goes after cyber criminals that essentially trespass electronically into a protected information system. And there have been certain calls by, as we understand, various agencies and others that maybe the Computer Fraud and Abuse Act needs to be amended to help combat insider threat. Because if you're inside an organization, you already have privileged access. The question is, does that law apply to folks that exceed the scope of their privilege or what they're really allowed to do? There's been a split in the federal courts, and so that's why some have said, maybe we need to amend that or at least explore that, because legally there isn't much of a federal criminal law mechanism to go after the bad guys that are malicious insiders. State of the Union address. Who here heard President Obama speak? I'm sure many of you when he gave the State of the Union address. I won't read the whole thing, but I thought that it was very interesting that he gave this quote about cybersecurity, cybercrime, intellectual property theft, invasion of privacy, government and integrating intelligence to combat cyber threats, and urging Congress to pass legislation to meet the evolving threat of cyber attacks, etc. That connects to the cyber threat info sharing legislation that I spoke to you earlier. At least my interpretation of it, and I'll give you my unofficial interpretation in the next slide, is that, and again, this is one person, it's not a HIMSS national thing, take it with a grain of salt. I am a licensed attorney, whether or not you think I'm a good guy or not. So in terms of the interpretation, my interpretation of what President Obama had said during the State of the Union address is that we need to make the networks and information systems more resilient against aggressive cyber attacks, and they are either sophisticated because they're technically sophisticated, but as I reveal on another slide, I mean, these aren't always 0 days, folks. I mean, it could be just simply that there's an integrated insider threat actor and phishing and malware all combined to hit you from all sides. And so in that way, and by way of pure combination, it's sophisticated. It does not need to be just one single component which is sophisticated. Intellectual property, those of you who may not know, includes trade secrets. It includes things such as patentable inventions. It includes even computer programs, should they be designed in-house by your hospital or other entity. That's very important for us to secure. Intellectual property, as well as secure information systems and networks, are the lifeblood of our nation's economy and national security. As an IP lawyer, I could say this, and based upon other conversations with my colleagues, I could say that one of the reasons why we're so successful in America in terms of our economic progress and advancements as a society is based upon our intellectual property and what we own from a proprietary standpoint to be leaders. Intellectual property essentially means that there's certain special information that our companies or we as individuals hold as owners, and we could exclude others in terms of patents from using them. We can license the rights to others, but we essentially dictate where that technology and where the means to implement that technology should lie. And so that's really, really important. And so when I got more involved in the sector, I can only say that it makes me sick that some folks want to steal our intellectual property and steal innovation, and even to the point where it can jeopardize our economy or jeopardize our nation. But that's why we have some good guys speaking to you later today. And what I also gathered from the State of the Union address as well is it's interesting because here President Obama had essentially said that he had addressed the cyber threat in the context that we need to combat cyber threats just as we have done to combat terrorism. And so I essentially took that line, my interpretation, and believe me, it's just simply an educated guess. It's clear that cyber threats are a national security problem, and we need to engage military assets and law enforcement and other national resources to defend our homeland in addition to the private sector. So what does cyber look like now? All of us in the room, we all know this, right? There's more hacktivists, there are more people that, whether it's for fame or power or economic greed or social or political ideology, they want to, essentially cause terror. They want to cause havoc with our information systems. So we're seeing more of that. We're seeing more nation-state actors. We're seeing more insider threat activity. What does that mean? It doesn't necessarily mean it can include an employee inside your organization, but it also can include a contractor, may even include someone at a cloud provider. Anyone with trusted, privileged access to your IT systems, can be a malicious insider, and they can cause and wreak havoc unless there's some kind of insider threat management program. Unless you're proactive about it, it will cause a lot of damage, and that's average of 74 days that you saw in the earlier slide. Understand that with insider threat, it can take years before the insider threat actor is caught. So that can be the most damaging. Destructive malware, not just adware, I think that we've all seen things in the news about destructive malware where the data gets corrupted to the point where your systems won't operate, and maybe sometimes there's physical damage. It's all over mainstream media and trade press reports. When I first started at HIMSS a few years ago, I was told, you know, how much does the healthcare sector care about this? It was kind of lukewarm, and now I think that we're up to the point where it's definitely a concern for everyone. And it's, you know, cyber is on everyone's minds. If it weren't on everyone's minds, we wouldn't have Hollywood pushing forth movies and TV on it as well. The evolving threat space. I'd spoken about more complex threats, such as the combination of malicious insiders and phishing attacks and nation-state activity. And in terms of threats you need to be aware of, and I am, again, picking some knowledge from my colleagues as well. Don't think that there are just 0 days out there that folks are just launching just to get you. There's a perception that, you know, if there's low-hanging fruit, the hackers will get at you if you are low-hanging fruit. So that said, I mean, there's unfortunately a lot of problem in this sector in terms of a lot of folks still not encrypting data. Some recent statistics I looked at, we may be more typical to encrypt data in transit, but perhaps not in storage. What about those unencrypted backup tapes? There's still very weak passwords. Hopefully the password will die, but we're clinging on to our passwords. Unsecured wireless connections. Those of you in the room, you know, probably have one of these. Think about it this way: it's a radio, folks, and think about all the vulnerabilities of radio and jamming the signal or intercepting that. There are also well-known vulnerabilities for poorly designed software with a lot of holes. Those of you that track the CVE system, how many vulnerabilities do we have that are out there and that are still available to exploit, that have been well known and documented for 5 years or 10 years or more? There's a lot of phishing that goes on in healthcare organizations. For Data Privacy Day, we released a tip sheet on how you know that you have a phishing attack, what to do about it, where to report it. And yes, we do reference the Internet Crime Complaint Center, which perhaps folks later this afternoon may want to reference. Elicitation, that does happen too. And finally, there's a huge problem, as you all know, in terms of aging IT infrastructure. You know, and for that reason, maybe some folks may want to move to cloud because it's more secure, and those folks may keep up the IT infrastructure a little bit better. So in terms of what's ahead of us, hopefully we aren't in for a cyber war, but that may be an unconventional war that we may have to deal with. We need private sector to work more with government. We need a feedback loop with agencies such as and including FBI and DHS. Security should be a primary business line. How many folks in here feel like security is sometimes like a secondary or tertiary consideration, budget-wise or otherwise? I think this is now the time for us to speak. We need to stay ahead of the threat, and you know, some of it is that we need to close the gap in terms of all the errors and mistakes and other things that humans do to create problems with us, so maybe automate it more. We need more cross-sector information sharing. And here's also another question as well. From my view, I would never advocate offensive maneuvers by someone in the private sector against a cyber enemy, but I guess the query is, are we willing to modernize our law to allow for cyber offensive maneuvers should we be under attack? Cyber defense is awfully difficult, and so, you know, either you have to be right 100% of the time, or you constantly have to address folks breaching into your systems and mitigating it and stopping the bleeding of data. I mean, it's just nonstop. Pathways to solutions, as I had mentioned, public-private partnerships, working with government, securing the humans, securing the technology, not only knowing what threats are out there now, but, you know, thinking about, okay, what can we predict based upon what we know in healthcare and what we know in other sectors. Cross-sector engagement too. Innovation. I mean, this country is great in terms of innovating, whether it's through our academic centers or federally funded research and development centers, government or the private sector. We need to stay ahead of the threat and harness the technology that is going on to make sure that the information exchange is through secure channels. And finally, we need to train and prepare for the event, even if it never happens. So in terms of getting engaged, involved with HIMSS, we have our HIMSS Privacy and Security Committee and a litany of volunteer-led groups. Currently, this year, Jeff Bell is the chair of our Privacy and Security Committee. It's essentially a steering group for other volunteer groups. And for any of you that may be interested in applying, please feel free to submit an application. We will consider it. This is the only group that we have that requires essentially that we select you, and there are just a few slots open, but it's by invitation only. All these other volunteer-led privacy and security groups are free for any active HIMSS national member to join, such as our policy task force. We're active on advocacy activities, such as what I had shared with you earlier today. Our cloud computing work group, which addresses, okay, how does healthcare intersect with the cloud computing sector? Our privacy and security toolkit content review task force, essentially making our privacy and security toolkit, which is available on our HIMSS.org website, usable, more usable from a user-friendly perspective. Our risk assessment work group to essentially teach folks what a good risk assessment is, what a thorough risk assessment is, and essentially what the best practices are. And this is my contact information and email address and all else. I also have references to our various toolkits and our NIST cybersecurity framework. Thank you. Thanks, Drew.